And welcome back. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress 2018, coming to you from Washington, D.C., and a very special welcome to those of you joining us virtually. I am so pleased to welcome to the studio Linda Riddell of the Validation Institute. Linda, so great to see you in person.
Thank you.
We've spoken on the phone, done a podcast. And Linda, you have just seen the inaugural Health Value Awards ceremony. That was our first one on Sunday, this past Sunday. How do you think it all went?
Well, I think it went well. I think we highlighted the people who had strong programs and strong results. And that was the real goal. Our part of it, the Validation Institute part of it, was about ensuring that the applicants, the finalists and winners, actually had done their measures correctly. And many of the applicants were quite impressive in how they had handled their data and composed their measures. So,
what was the process like? They were nominated,
right?
And then they had to present numbers and evidence that they were doing exactly what they are marketing themselves to be doing. Is that right?
Correct. In our usual measure review, we start with a literature search, ensuring that the intervention that they're describing actually has been shown to have the impact that they're describing. But for many of these interventions or strategies, it was obvious what the result would be. So reference-based pricing would be lower cost than paying charges, for example. So there's not a literature search with that. And then our next step was to look at their data sources. It could be medical claims, but it could be participant surveys. It could be also what data source did they use for their reference point for comparison, saying we did better than the market, for example, if that was their angle. And then did they use the data correctly to put together the measure in their statistical model?
Did you find anybody who was not doing what they said they were doing?
Not in the finalists. I was not involved, though, in the earlier process of winnowing it down to the finalists.
Okay. What does being validated by the Validation Institute mean?
It means that an independent team of scientists have reviewed and verified that the results you are claiming are true. So if a vendor comes to an employer and says, if you put our program in place, we will reduce your emergency room visits, we will reduce your hospital stays or length of stay, that purchaser knows that an independent objective team has said, this is done correctly, it's described correctly, these are the results you can expect.
So over the past year, you've really been combing through a lot of information, getting to know a lot of different companies. Anybody you were really impressed by?
I'd have to say it would be Integrated Muscular Care. And I think I don't have their name quite correct, but it's just IMC. They did a fabulous job of putting together their data and tracking their patients and participants so that it included not just the intervention for the muscular condition, but also the imaging and pain scores. I think they included pain scores. So that was very impressive.
And do consumers really look at this kind of information?
Patients do not. Purchasers.
Should they?
When you're ill, you're scared. This is not data that you're going to seek out at that point. The real point where it is of value and impact is at the purchaser level, meaning the employer or plan level, so that they could say, for example, if you go to an integrated muscular clinic, your copay is $0, versus any other place your copay is whatever, $30, $50. That's where I think this kind of data works. Patients are sick.
Okay, but purchasers absolutely should be doing their homework and looking at information like this?
It's not even doing their own homework. They can use validation or any independent review as a threshold so that they're not spending a lot of time, energy, and resources on programs that don't have results.
Mm-hmm. And have you noticed that lately more purchasers are doing this?
We're getting approached by more purchasers and some large employer coalitions that are making this part of their RFP process, so that vendors who have validation have an edge, get a preference in terms of winning the business.
Okay, Linda Riddell, thank you so much for your time.
Thank you.
Appreciate it. And I'm Mabel Jong. We appreciate you watching, so stay tuned.